Okay, I'm really ready for this. I'm going to add my special guest. He is going to get the invitation, and we're going to do this because it's information. So I'm inviting Dr. Howard, who is amazing. He is a communication and behavior modification expert. He has such a cool perspective on life, and I got it. Yes.
Finally, I am a real person.
It's all right. It's a learning curve. Now you know. Now we got some simplicity. Oh, so I keep switching that over. It only gets easier from here. So welcome. I'm so glad we did it. People are going to love what you're going to share with them today. So I'm so glad we could figure that out. So I gave a brief intro about some of your background and your book you have coming out, but I would love you to introduce yourself and tell us a little bit more about you.
Okay, my name's Dr. Howard Rankin. I had a long career as a psychologist. I'm now a writer, podcast host, and I was fortunate enough to have Shannyn on my show, and we definitely resonated. It's interesting because, you know, I'm an old guy and I was trained back in the last millennium. And it's interesting, when I was trained really in a very behavioral approach to health and to mental health, my view has changed significantly over the years and is much, much more aligned with what Dr. Shannyn is preaching. I've read some amazing things. I'm learning all the time. And one of the things really that I've come to appreciate very much is we have this mind-body or mind-body-spirit, however you perceive it. We have it. It's made up of trillions of cells that are all communicating all the time. Candace Pert brought out a book in 1995 called Molecules of Emotion, in which she described this. That was 25 years ago, groundbreaking. 25, now 27 years later, we understand a lot more about that. And there is this fantastic complexity, mind, body, all of these cells working. And what that does is, in any situation, it puts into consciousness sort of the best guess of what is happening, all right? So you see something, let's say, and your mind body says, oh, careful, that could be a snake, okay? And in your consciousness, that's what you think. But it's a best guess based on your experience, based on your history, based on the environment, based on your mood. It isn't necessarily the truth. What it's saying is, watch out. And of course, the brain is geared for our survival, so it does that. It doesn't mean there's a snake there. It says, check to make sure, just in case. But what we tend to do is automatically accept what these hypotheses, these ideas that are presented to us as the truth. And you know, that's where we need to be much more aware generally about our thinking, but about our overall functioning and our overall health.
Yeah. And I think modern day people kind of think of that as like fight or flight, right? We're constantly in that fight or flight, but it's because we do go almost to worst case scenario, right? Most of the time. Right. And it's unlearning that, right? That's one of the things I really love to teach people, is how to unlearn your automatic responses, because you can. It takes work, it takes repetition, but you can get yourself from being that kind of chaotic worst case scenario person to, no, let me really look at this with curiosity, right? Let me see why my body is telling me this, and see if I can find a logical explanation instead of just assuming, right? Whether it's someone else's behavior, something somebody said, or something you come in contact with, or something your body is doing. I get a lot of people who, one feeling, a sensation, and it's worst case scenario, right? It's cancer, it's the we're just like that as humans. But I believe that's why we have so much physical and mental illness, because we live in that pattern. So speak to me a little bit about that. How do you help someone start to either identify that, or how do we unwind that? Like, where do we go from here?
Well, in some ways, in some ways, it's not really our fault. You know, survival is still the main driving force of the brain. We haven't had a brain upgrade in thousands of years. And just think about the complexity of life now compared to what it was thousands of years ago, where survival was really the only thing. Where are we going to get to eat, make sure I'm not going to get attacked, et cetera, et cetera. And we still are operating on that principle, even though the world is much more complex. We have the potential to have a better understanding of it. But, we still automatically go with, oh my God, worst case scenario, you know? And we have to learn that. We have to learn that don't jump to the first thing that your brain tells you or your consciousness interprets.
Yes.
Stand back from that. The problem with that, though, of course, is in a complex world, people will say, well, that's great. Who's got time to do that?
Yeah.
And that's another issue. When do you do that and when don't you? And so it is understanding that and learning the critical points, when you back off from that. If it's where should we go for dinner tonight, honestly, you don't need a deep dive into all the variables that could influence, whatever. You don't need that. But when we're talking about major life decisions, then you need to step back. The problem is, if we live in that sort of simplistic binary world most of the time, it's really difficult to step out of it when you need to.
Yeah. Do you have a series of, like, when you say step out and observe all the kind of things, what do you have, I know there's no checklist for life, but what would you think? Like, if somebody steps out of that first reaction, what are some things you can take yourself through to decide, like, is this really something that needs me to go into survival mode, or can I have a different approach to this?
Yeah. In Falling to Grace, I talk about, which is about the art of redemption, I talk about your amygdala, which is the area of the brain that processes emotion.
Yeah.
And I have this phrase, turn off your amygdala if you haven't already done so.
Yeah.
Like we talk about phones, right? At least turn it down, all right? So you get an emotional response which drives your conscious process. Just turn it down, step back, step away, and try to look at this a little more objectively without the emotion driving your perception, your experience, because it will do that.
Yeah.
Unless you intervene.
Yeah.
Yeah.
And it sounds so simple, but honestly, it's something I teach all the time too, is we have to spend more time slowing down. And sometimes it's just giving yourself a minute of silence. I've been talking a lot about that recently. It's like, how often do you just sit in quiet and allow the emotion to calm a little bit, and then see what actually comes up after that? Not in the chaos, not in the loudness of your brain yelling at you, but truly just taking even 2 or 3 minutes, put your hand on your heart, just take a second and see if your decision-making process feels different from that place versus the, modern society was like, the text message that comes in and you want to say the first thing, or like, we have that instant reaction. But if you would truly just give yourself, it's 2 to 10 minutes, right? It doesn't even have to be like a whole day. Like,
Right.
Slow it down and then reevaluate how you would respond to that is huge. And I think we'd have a whole lot less craziness and a lot more understanding for people in general if we would just slow down a little bit before reacting.
Yes, no, absolutely. And mindfulness techniques, meditation techniques in the broader sense, we have to practice that. Just because we decide, I better step back. Okay, great. Awareness is the first step. But unless you practice it, you're not going to be able to do it because it's not easy, right? So you actually do have to practice that. And you do have to question yourself. I think we talked a little bit about this on the podcast, but it's like asking, where did you get that thought first? Suppose you could actually log onto the computer and say, when did you first, have that thought or that opinion? How old were you? Who told you? What were the circumstances? And be able to look objectively at how these ideas in our heads were formed. We might be able to look back at them and say, well, wait a minute, I was only 8 at the time, and somebody told me I was an idiot, and I believe that ever since. Why do I believe that? And so it really takes the ability to step out of the normal editor in your consciousness, the normal habitual ways we think, really to look at ourselves differently, which is incredibly liberating psychologically, but also physically.
Yes, physically for sure. This is one of the things we talk about patterns a lot. Like we get stuck in a pattern. Your nervous system gets stuck in a pattern. Your
Right?
physiology gets stuck in a pattern. And if you want to break anything going on in life, your anxiety, your depression, your weight, your mood, your relationships, if there's a pattern that keeps showing up and you're unhealthy with an area of your life, any area, right? Your business, it doesn't matter. It's about unlearning those patterns and replacing them with healthier ones. But it does take practice. When you go to do that normal thing that would normally be your pattern, taking a second to realize it and then replacing it with a healthier pattern and doing that over and over again, eventually you'll rewire enough circuits, right, that
That's
you'll
right.
become your normal, but you've got to do it consistently. But I can tell you the people who do it consistently, really cool things happen. Like you see some massive transformation, breakthroughs in health and physical healing just by really replacing those ingrained patterns that we learn through childhood, through trauma, through all the crap, right? It gets stuck in there. And it's up to us to rewire that. And you can. That's a fun thing. That's a cool thing, right? You
No, no, no,
can.
no, and absolutely. And I've seen people.
Mm.
I mean, I've known 2 people diagnosed with pancreatic cancer. Told basically, you're in big trouble. Who refused to accept not the diagnosis, but that there was nothing they could do about it.
Right.
And they went and said, I know I can beat this. They had that mindset. They went and learned all the healthy things they could do. And they've survived 20 plus years, both of them.
Yep.
And you look at that and you say, oh my gosh. But I know other people with other conditions who've done exactly the same thing. And it's not about necessarily denying the diagnosis,
Right.
denying the prognosis and saying, I believe I can do something about this with the right mindset and the right behaviors.
Yeah.
And I've seen it. And I know you have. You've seen it.
So there's even really basic medical studies, right? Not even talking on our more holistic side that show like survival rate for breast cancer. People the mindset was the bigger factor. Their support network, whether they felt loved and supported at home, those had just as much factor as what treatment they chose or what stage they were in. And that's very medical research, and they're showing signs of that. And we know on a deeper level that that goes a very long way. But it's about finding. So if you were to take somebody who, this is brand new information to them, right? They have no idea what to do next. What is one of the easiest things you can start telling them or asking them to start implementing in their life, to start thinking differently?
Well, I think the first thing is sort of a recognition of what we've been talking about, that our consciousness is habitual. We use the same editors. We look at the things the same way, but we don't have to do that. And doing some mindfulness or meditation exercises where you practice being in the moment, but not judging, not processing, just experiencing things. It's amazing what happens. I used to run a program in a wellness class. I want you to eat the grape, but what I want you to do is focus on the eating. And people would say, oh my gosh, I'd never tasted it like that before. Or, what have you. In fact, one woman came in, she said, oh, I'm not going to have grapes, I'm going to have my coffee. And afterwards she said, you know what, I thought I liked coffee, but I really don't like the taste.
Right. Yeah.
And, it's just amazing when you stop processing, stop editing, and just experience and practice that. It's amazing what happens. Amazing what happens to your perception. It's incredibly liberating. You'll find yourself walking down the street and suddenly you're seeing things differently. You're seeing them for what they are, not top-down processing, you putting your judgment on what you're seeing. But what's called bottom-up processing is let that come to me. And what do I make of that? How do I see that? How do I perceive that? And that's the core. Once you can do that, then you're open up to doing this in any number of situations. But you got to practice doing that and be open to it. But it is probably the most liberating, maybe healthy thing that you can do. We look at things, here are my glasses, habitual lens, through the same thing. And we have to be aware of that. And I personally believe that wisdom is about understanding that.
Yeah.
Wisdom is understanding that. There's a difference between being smart and knowing a lot of stuff and being wise, which is knowing how perception works and how that can influence you at any one time, but also how you have the power to access that.
I love that. And it's giving power back to the person, right? In my case, to the patient, right? You have control. I get so many messages saying, well, my doctor wouldn't do this, or they wouldn't run this lab, or I don't have access to this. And in that circumstance, they feel so powerless when there are so many things that you, just as a person, can take back that power and get amazing transformations. And that, I love the way you shifted that. The mindfulness I get, but I think people hear mindfulness and it's kind of just become this buzzword. They don't even know how to be mindful. I love the way you explained it about just experience life again. If you're walking outside, what does it feel like? What does the sun feel like? What does the ground feel like? If you're eating, take it in, experience what you're doing in the moment. Don't be thinking about what happened an hour ago. Don't be worrying about what you're supposed to do later today. In just this exact circumstance, how does all of this feel? How do you taste it? How do you smell it? If you can just do that in all the little moments of the day, you're living a full life instead of trying to get to the next step. And I think for so many of us, myself for many years, that was it. I was always just trying to get to the next thing, the next place, the next, job I had to do, whatever it was. And you miss out on life, truly, all the moments. So I like that. So that's everyone's challenge for this week, is to be present in your experiences. Slow down and just actually be mindful of where you are. And just pay attention to all the little things you get to do in the course of the day and see how that shifts your perspective. So that's very cool. I want to ask you, go ahead.
No. I think that's really a core life skill.
Yeah.
I really do.
That needs to be taught in schools, right? I'm thinking about my kids. Those are things for them to learn at 2 and 7 now that I wish I would have known. That didn't take me as long as it took me to figure it out, right? Those are things to teach children and young and teenagers with all this anxiety and depression and things that they're going through. That's such a beautiful resource for anybody.
Absolutely. Yeah, absolutely.
So last time we talked, I didn't know about your book that's coming out, but I want you to touch on the whole redemption thing, because so many people are caught up in a failure, a bad decision. They feel guilty. They hold on to these things. And I bet you never meet somebody who doesn't have something, right, that they feel like they've messed up in the past. And it can hold a lot of people back. And I see it all the time with healing, right? When you have that guilt or that resentment, and definitely in life, going for your dreams and doing those things. I think that is huge. Can you touch on that a little bit?
Yes. And the book is based on actually my own experience. I've been a psychologist for a long time. I had an interaction with a rather difficult borderline personality patient, but we worked pretty well together. And then she left therapy, found another therapist. But she said, "Oh, I'd like to come back and see you socially." And so she'd pop into my office, once in a while. This went on for 4 years. And one time leaving my office, she hugged me, she kissed me, and it degenerated into a very brief, very consensual encounter. To cut a long story short, a month later, the licensing board said somebody had complained about me for sexual misconduct. And 6 months later, my license was revoked, and it was in the newspaper, locally and statewide. And here I was facing shame, guilt, humiliation. And what do I do in that situation? And it's been an incredible journey. It's been almost 10 years since then. Incredible journey of learning how to accept. Very easy in those situations to play the victim, deny, say, oh, my lawyer screwed me over, or, this one did. But no, you did something irresponsible. So you have to own up. Now, it may be the what was handed out to you as punishment may have been too much, too little, but that's irrelevant. You have to accept where you are, and then you have to make the decision. How do I make the best of this decision? How do I make the best of this? If in 5 years' time this was the best thing that ever happened to me, what do I have to do now? And so I walked that journey and learned a lot about acceptance, about dealing with shame and guilt, and how to be honest and authentic and face up and move forward. And so now I've written this book, which uses my experiences as a basis to tell people, here's what you really need to do. Here's what you can't do. You can't get stuck in victimhood. You can't get stuck in revenge fantasies. You can't get stuck. You've got to make your life meaningful and move on, however you do that. And for me, it was starting a writing business that has really grown really well. I've met some amazing people, written tons of books, and it's just been phenomenal. And so I want to pass that message on to people. There is hope. There is actually, this is going to work out way better than you even imagined.
Yeah. I love that. Shame and guilt are debilitating for a lot of people, right? Because they allow it to be. And I don't think enough people speak openly about it because
they don't want to.
Right? You don't want to. It's such an uncomfortable conversation. But when people realize that it doesn't have to be, and you can move through it so much easier if you are open about it, right? And acknowledge it and deal with it head on and not try and squash it down and blame everyone else. That's so powerful because I talk about it all the time. Shame, guilt, unforgiveness are probably the main in trauma reasons for your physical imbalances. And if you don't address it head on, we're not going to get anywhere. I can't give you enough herbs in the world. I can't test enough tests in the world. If you don't acknowledge that and learn how to process through it, it's not that it disappears, it's the processing. We're going to get stuck over and over again. And that's the piece that's the breakthrough for a lot of people.
Right. And it's like trauma. If you do not resolve it, it stays there and imprints itself on every aspect of your life. You cannot allow that to happen, and you've got to be authentic. You've got to be honest. You got to be bold. You got to be courageous. I started telling everybody about this, just like I have you. And it was one of the best things I did. I can talk about this now without feeling guilt or shame or what have you, because the response that I've got most from people is, well, thank you so much for telling me. They don't expect you to. Thank you for your honesty. Thank you for your authenticity, right? I understand this now better, but if I'm not going to tell anyone, I don't want anyone to know, I'll be like that for the rest of my life. I'll be hiding, and I don't want to live in hiding. I don't have to live in hiding, right?
I love that. And so many people need to hear that. I think that's so...
I think so.
This is good. I fully believe it. I see the other side of people who are living in that too, right? And it's just, it's debilitating for a lot of those people. So powerful. Thank you. Tell everybody as we just get ready to sign off, where are the best ways to find you? How can they follow you? How can they get more of your insight? Where can they go?
Sure. I have my website, drhowardjrankin.com. I got several, but that's probably the easiest one to learn about me. My book is up for pre-sale right now on Amazon, Falling to Grace, The Art and Science of Redemption. Actually, I have an author profile because I've got lots of books there, so you can look at that and see if there's anything there that intrigues you. Awesome. So those are the main things, really.
I love it. And then his podcast, How Not to Think, was amazing too. So make sure you guys go and follow that. Thank you so much. I love having these open conversations. The more people can hear tips and tools and things to really help navigate life, right? All the stuff I think is so helpful. So I appreciate you coming on. I'm glad we figured out the tech part and made this happen. Thank you so much. Everyone go follow him, and we'll be back next Monday with another guest. So thank you guys. Have a great week.
Thanks so much. You take care.
You too. Thank you.